abdominal X-rays. There's an X-ray made of the abdominal contents, and it is made to see if there's an organ enlarged or if someone has swallowed something which is to be swallowed. And there can be seen patterns of fluid and gases that can indicate if there is an obstruction of the intestine or a perforation of the intestine if the gas is outside of the intestine. And calcium is opaque to X-rays, so it can maybe help to find gallstones or kidney stones or also aneurysms. And that is according to the Illustrated Medical Dictionary written by Sue Davidson, Penny Preston, and Francis Williams on the page 5. But this is no substitute for medical knowledge and also no medical advice. Hi and welcome. I'm trying to learn medicine. Today, abdominal X-ray. And after this done with, we're going to do squat training. And if you participate in the squat training, and we're talking about internal anatomy and things, and this is no medical advice, I'm just trying to read and to understand it. Abdominal X-ray. That is an X-ray examination of the abdominal contents. X-rays can show whether any organ is enlarged and can detect swallowed foreign bodies in the digestive tract. So an X-ray is done of the abdominal contents of the abdomen, and it is there to look if an organ is too big and if someone maybe has swallowed an object which shouldn't be swallowed. They also show patterns of fluid and gas. Distended loops of bowel containing fluid often indicate an obstruction. See intestine obstruction. Let's cover actually. Intestine obstruction of a partial or complete blockage of the small or large intestine. Causes include a strangulated hernia, stenosis of the intestine, often due to cancer in the intestine, intestinal atresia, adhesions, volvulus, and intussusception. Intestinal obstruction also occurs in diseases that affect the intestinal walls, such as Crohn's disease. In less common cases, internal blockage of the intestinal canal is caused by impacted food, fecal impulsion, gallstones, or an object that has been accidentally swallowed. A blockage in the small intestine usually causes intermittent cramp-like pain in the center of the abdomen, with increasingly frequent bouts of vomiting and failure to pass wind or feces. An obstruction in the large intestine causes pain, distension of the abdomen, and failure to pass wind or feces. Treatment involves emptying the stomach via a nasogastric tube and replacing lost fluids through an intravenous drip in some cases. This will be sufficient to correct the problem. However, in many cases, surgery to deal with the cause of a blockage is necessary. So, as the word says, obstruction of the intestine. So, and they can show patterns of fluid and gas. Distended loops of bowel containing fluid often indicating an obstruction. Gas outside the intestine indicates intestinal perforation. Calcium, which is opaque to X-rays, is present in some kidney stones. I don't know what color opaque is, but that's interesting. Calcium is opaque to X-rays and therefore kidney stones can be visible. See calculus urinary tract. Let's compare. Calcaneus. The heel bone. It can't be. Let's look. Cal, C-A-L-C-U. A deposit on the teeth. Let's see that also in a moment. Calculus. Yeah, but it's all together. So first, calcaneus is just a heel bone. That is a bone. And then we're having here calculus. That is a deposit on the teeth or a small hard crystalline mass that is formed in the body cavity from certain substances and fluids such as bile, urine and saliva. Calculi can occur in the gallbladder and bile ducts, see gallstones, the kidneys, ureters or bladder, or in the ciliary ducts. Okay, calculus dental, a hard crust-like deposit, also known as tartar, found on the crowns and the roots of the teeth. Calculus forms when mineral salts in saliva are deposited in exquisite plaque. Supragingival calculus is a yellowish or white deposit that forms above the gum margin on the crowns of teeth near the openings of salivary gland ducts. Subgingival calculus forms below the gum margin and is brown or black. Toxins and calculus cause gum inflammation, see gingivitis, which may progress to destruction of the supporting tissues, see periodontitis. Calculus is removed by professional scaling. Attention to oral hygiene reduces recurrence. And calculus urinary tract, it's long, is down in the kidneys, ureters or bladder, formed from substances in urine. That was not so good. Okay, the book is from the early 2000s. 2002. Now, calcium, which is opaque to X-rays, is present in most kidney stones and in some gallstones and aortic aneurysms. Calcium is in aortic aneurysms. These can sometimes be detected on an abdominal X-ray. Okay, I think we have an abdominal X-ray, where an X-ray is done of the abdominal contents. It can show enlarged organs or swallowed foreign things in the digestive tract. They show patterns of fluid and gas. I don't know what the word distended means. And that way an obstruction of the intestine can be maybe found. Let's take one look at perforation, but I think they're saying it just what it is. That's exactly what it says. A hole made in an organ or tissue by disease or injury. If there's gas outside of the intestine, that could indicate a perforation of the intestine. And it can then show calcium, which is opaque to kidneys, to X-rays. And so kidney stones can maybe be found, or maybe also gallstones and aortic aneurysms. I'm going to stop this in camera. Abdominal X-rays. There's an X-ray done of the abdominal. What is the word for it? Abdominal contents. Abdominal X-rays. There's an X-ray made of the abdominal contents, and that is made to see if there's an organ enlarged or if someone has swallowed something which should be swallowed. And there can be seen patterns of fluid and gases that can indicate if there is an obstruction of the intestine or a perforation of the intestine if the gas is outside of the intestine. And calcium is opaque to X-rays, so it can maybe help to find gallstones or kidney stones or also aneurysms. And that is according to the Illustrated Medical Dictionary written by Sue Davidson, Penny Preston and Francis Williams on the page 5. But this is no substitute for medical knowledge and also no medical advice. Want to stop the camera? And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine, where we will continue with medicine. If you stay here and participate in the squat training med det spelet jaunisk, we're bringing one leg up. A mushroom. Another grating mushroom. And a waving mushroom. Leg up. And take one leg at the ankle. Crane. Tailbone. Change. And the train stop. The toes are pointing in front. We're stretching the inner side of the leg. And go from side to go first to one side. Keep the leg. And now go from side to side. The bend. And now for squats. Legs wide apart and 12 of them. So number 1, 2, and 3, and 4. We're having 1/3, 5, and the next one is already the half. Second half, 7 and 8. With 9, we're having 3/4, the 10, and now the last pair. Most of the exercise. Next exercise is the 6-back squat squeeze. Quarter squat. And press against the upper part of the leg on one side. And on the other side. Half squat, press in the middle of the leg. And on the other side. 3/4 squat, press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water pump. 3/4 squat, press against the knee, go towards it, press, go towards it, press, go towards it, press, go towards it, press, go towards it, last one, and up again. And the last exercise is the propeller, full squat, arms to the sides, over to one side, press against the leg, look up to one hand, middle, over, press again, look to one hand. And again a bit stretching. One heel onto the ground and pull the toes in. Pull to the left, pull in. To the right, pull in. Middle, move from left to right. Upper heel onto the ground, pull the toes in. Pull to the right, pull in. Left, pull in. Middle, and move from left to right. One leg again up. The other one. Again, take it over here. Next to the side, spread your finger down. In and up. And really feeling close for legs. And breathing out. That was the squat training. I thank you very much, and until next time.